We have one recreation therapist who's employed full-time, and many of the counselors will assist him. And they do a wide variety of activities. In this room, we have table tennis. We also have a small kitchen area. A lot of the folks that come in enjoy getting back to doing things they have not done in a long time because of their addiction. And they have baking groups here. We have the summertime, we have picnics that the patients will actually help to prepare food for. We have table tennis tournaments. In the other large room here, we have more activities. A rec therapist and a former rec therapist who has since moved on to a different job designed the micro golf course. And then we also have a variety of exercise equipment. A lot of our folks, when they come in here, like to start getting themselves back into shape physically as well as mentally, and they spend a lot of time down here. And then we have a smaller room in here where we have a couple of dartboards that get a good bit of use. And our rec staff also does outside activities. We have softball games throughout the summer. They will take trips, what he refers to as nature trips, up to the Black River area. They do a lot of trips to the art museum here in the city.
Hi, my name's Dean. I'm an alcoholic and an addict, and this is Inside Addiction. Today we came back to where it all began for me at McPike ATC in Utica, New York. I want to introduce my guest today, the Executive Director of McPike, David Esper. David, thanks for joining us.
It's an honor to be here with you.
I remember when I came here, I sat in the counselor's office, and Mary Rose was my counselor here. And I sat in there, and she basically told me, are you willing to go to any lengths? And it wasn't a matter of for your family, for your car, for your house. It was, are you willing to go to any lengths to live?
And your answer was?
My answer was, and I still tell people to this day, if Mary Rose, and I told her that day in that office, if Mary Rose told me to wear a pink dress every day for the rest of my life, and that would keep me sober and alive, I hope I look good in it. I tell people to this day that story.
Yeah, because if I remember right, you wanted to give up the drug but maintain your addicted lifestyle.
Absolutely. I fought that tooth and nail, and it wasn't even entertained at McPike. It was,
well, we probably laughed to ourselves about it.
Yeah.
I mean, you produce nice fodder for the lunchroom. But, you know, we see this all the time, and, you know, after a while, you don't think it's crazy. It's just part of the person and what they bring to treatment. And in a serious way, that's really what this staff is excellent at doing, at engaging somebody where they are, and with their permission, be willing to push them so that they can do something that's very difficult. I mean, this is a very difficult disease. It requires an intimate understanding and knowledge of yourself. It is primary, it is progressive, it becomes chronic, and it has all of the chronic outcomes of fatality, incarceration, and mental illness. So people come in this at different levels. You need to engage the people and try to bring them to a level that at that point is good enough for them.
It's interesting that you just said that. One of the favorite things I've ever heard is people with an addiction have the only terminal disease that they can truly decide if and when it's fatal.
Correct, because
no one else with a terminal disease can make that decision.
That's true.
What keeps you coming to work every day?
The fact that every day at McPike I see miracles happen. I see people that couldn't walk in the door with a straight line doing very well on their way out. to listen to patients tell me what a wonderful staff that we have here at McPike. It really is about the miracles, and I've found this to be since June 28th, 1979. This is going to be my 30th year anniversary of being in this field. I came into it very much by accident, but I had mentors who were people in recovery who worked in this field, who helped me, a social worker, learn what I needed to learn to become a successful then CAC and now KSAC. So it's remarkable. Look at yourself. Here's a miracle I'm sitting with. I mean, think about how you were. Think about how you are. Okay. I started in the field back in 1979 at a place called the St. Lawrence Addiction Treatment Center. I came down here in 1999 as the assistant director after having spent 5 years there as a social worker and 15 years there as the assistant director. And in 2004, I was lucky and fortunate enough to become a director. McPike's a very special program for a multitude of reasons, but perhaps the biggest reason is the fact that we have an integrated dual recovery program with the Psychiatric Center.
Oh, great.
So,
so is that like a MICA program?
MICA, but point of emphasis being, as you saw from your walking tour of McPike, we need people to be psychiatrically stable. Okay. There's too many places that you could hurt yourself, and we do not have staffing like a mental health facility would.
Right.
But when we talk about doing co-occurring disorder treatment, we're talking about doing the same amount of treatment on the mental health side as we do on the addiction side. So we're treating both disorders at the same time. I also should say that along with the concept of being a co-occurring disorder program, we have been tobacco-free since November 15th of 2005.
Oh, wow.
And we have been addressing problem and compulsive gambling since 2006.
So that also covers a lot of the transfer addictions as well.
Yeah, OASIS, the Office of Alcoholism and Substance Abuse Services, has encouraged its providers to be treating all of the patient's addictions at the same time.
So it's not focus on one,
right?
But if you focus on one and not the other,
yes,
that's what they're going to fall back on.
Right. So if you come to us